Hi friends, Peter Uzelac, the Embryo MD here. A lot of times in our field of reproductive endocrinology, we have patients that come to us and they're convinced that they know the diagnosis underlying their struggles with becoming pregnant. One common sentiment is patients feel like they are just having trouble implanting. So they're making embryos, but they're just not implanting them. So let's go through what kind of approach we would take to understand if that's indeed happening or not. First of all, I think the natural focus would be to look at the uterine side of the equation. For a pregnancy to occur, we simply need two things. We need a high-quality embryo, and we need a uterus to put that embryo to, and that basically achieves a pregnancy with hormonal support. Let's assume our embryo is fine. Let's kind of assume that that is high quality, and let's talk about the uterus there. So first of all, the way I would approach the uterus is we kind of break it down from two factors, and one of them would be what we call macroscopic, so large structural pathologies such as polyps or fibroids or sometimes scar tissue, and the other one would be more microscopic. That would be things like inflammation or maybe an occult bacterial infection in the uterus. So when we feel like implantation is not occurring, but we haven't done the proper tests for those two items, then we really don't know what's going on. So what are the proper tests there? Well, for the more macroscopic things, you can do that through either some imaging studies or through more of a surgical type of procedure. The imaging, typically that's most accepted and also the easiest to perform and the most comfortable for patients would be what's known as a saline infusion sonogram, or SIS, where some simple saline water is placed into the uterine cavity and then an ultrasound is performed, and it'll tell you if there's anything structural going on there in terms of polyps, fibroids, scar tissue. The other test that can be performed for that would be a hysteroscopy, hystero referring to the uterus and the scope referring to the camera that's used to look inside the uterine cavity directly and visualize that cavity on a television monitor or screen and see what's going on there in terms of any structural pathology. There's also some secondary benefits because you do see the surface of the endometrial cavity up close and you get some assessment on whether there's something kind of more subtle going on there. That's the macroscopic look at the uterus. The microscopic way to look at the uterus is a little bit kind of, debatable or controversial right now in our field. There's a lot of focus been put on that. But I think most of us would agree that there probably is some benefit in looking for some kind of inflammation or subtle, again, what I call occult bacterial infection at the level of the uterus. So something that wouldn't be bothering you, you'd have no symptoms of this, but it may be just enough to be causing you trouble to implant. The test for that is, again, a few different ways you can approach that. You can do a biopsy looking for some inflammatory cells, or you can do a biopsy actually looking for the actual infection itself and the actual names of the bacteria that are affecting you. So that would be more of a microscopic, a smaller item look at the level of the uterus. So if you haven't completed those two things, macroscopic evaluation and microscopic evaluation, you don't know if you're like was suggested by the patient, I'm just not implanting. You don't know that because you haven't looked at those two things. The other thing to consider would be the embryo side. Let's just say that you indeed are making embryos, but they aren't implanting. That doesn't mean necessarily 100% it's the uterus. It could just be that the embryos are very poor. So the embryos are made in the fallopian tube where the egg and sperm meet, and they travel down the fallopian tube to implant in the uterus. But if they're not of high enough quality, they're not going to make it through that journey. And as they're going through that journey, they're actually progressing in terms of their development. So if you have a poor quality egg or poor quality sperm, the embryo can be made in the fallopian tube. It can start to develop and start to move down the tube, but it doesn't actually go through that whole process. And so it never even makes it to the opportunity to actually implant because it doesn't even make it that far. That could be occurring, or it could stop right at the point. It does make it in terms of progression and place, but it just stops right there at the point of before actually latching on to the uterus. There's a lot of stuff at play there. Of course, in the embryo side of things, in order to test that, the only way you would know about that is if you went into the IVF laboratory. So you actually see if you made high quality enough embryos that they actually do develop. And so we would infer that happens in your body too in vivo. In today's day and age, we can test genetically for chromosome status through something called PGTA. That would give you another clue if you had normal genetics with that test, that you're actually able to do that in your body as well. So you have normal embryos. And so that would also discount the idea that I'm making embryos, but they're just simply not implanting. I hope that helps break that down through that example of, how we approach things diagnostically in a very regimented fashion to kind of unpack these kind of hunch feelings about what's going on in terms of you're having trouble conceiving. So I hope you found that useful. And if you did, please give me a thumbs up on this video. And please don't forget to subscribe to my YouTube channel, The Embryo MD.